we'll do this before we get to questions, but give some overview of COVID-19 vaccine, about what to expect with allocation and delivery to the local areas of the people who may be viewing this. And also then we can get into more specifics with the vaccine. I think Dr. Morcom will probably talk about some of the specific vaccine candidates, and then we can all address some concerns that people may have about the vaccine and address some of the vaccine hesitancy with the goal of providing some confidence in the vaccines. So I have been involved with vaccine education, training, implementation for about 20 years. And I've done things here at the organizational level at Gunderson Health System, but also on state and national levels. And I think that this is pretty complicated. In fact, we can say this is probably the most complex public health endeavor of all time in terms of how this vaccine is going to come in, the different candidates and different profiles of the vaccines, and how it's ultimately going to be allocated and then delivered to local areas and vaccine providers so that we can ultimately get people vaccinated. It's also the most important one of my lifetime because this is the potential for us to start to really get through the pandemic. And one of the big overarching themes that I would like people to realize, whether people are happy about this or not, public health has the word public in it, and it does mean that we're all connected together and that we all have to work collectively to get through the pandemic. And I could put this in the terms of a sports analogy. You know, we all are interested in our own individual health, but public health really requires us to behave and act differently. It's a lot like an individual sport like golf, which is probably a bad example for me because I'm a terrible golfer, but more like a team sport. In golf, if you know, you can go out there and do your thing, and you either you know, you'll do well or not well, and it's all on you. In this case, it's more like a team sport like football, where we can have different perspectives, we can have different ideas, we can have different points of view, we can come from all kinds of different backgrounds. But when we step out onto the field, we have to act collectively. And in the case of this pandemic, we need to all work in the same direction. And that includes the simple public health measures like hand washing, you know, masking, keeping distance, avoiding crowded indoor spaces. And then we'll have a new tool or new tools coming up soon, which are the vaccines. And we really need to all work collectively in the right direction to have a good result, and using the sports analogy, win the game. And this is a high stakes game. We really want to emerge from this pandemic. So those are my big overarching principles that we want to work from. We're really encouraged by the fact that we will have these new tools coming soon to our area, and we want to make sure that we use them. A couple of notes about the big picture. Here is what people should expect. And I know there's a lot of headlines and people are getting a lot of their information that way. We actually know that the advisory committee for the FDA voted for a recommendation down to age 16 for the first vaccine, which is the Pfizer messenger RNA vaccine. The FDA is reviewing that information. They could vote and approve an emergency use authorization as soon as today, but it may not come today, as reported in many of the headlines. So it's possible, but not necessarily a definite. The advisory committee for immunization practices for the CDC then needs to meet, and they have meetings on Friday and Sunday. And we're lucky in Wisconsin that we have two Wisconsin residents who happen to be on that ACIP work group. So we're fortunate to have them in our state and representing the state of Wisconsin as well as the rest of the country. At any rate, they are meeting Friday and Sunday. What they have to do once the FDA gives an emergency use authorization is give recommendations that will give even more guidance to all of us that will be in the vaccinator planning stage. But at the state level, the deliveries don't go out until both the FDA approves and the CDC approves, and then shipments will start to go out from the national or federal level to the states. Once at the state level, then it has to be allocated to all the approved vaccinators, of which there are many throughout the state. The public comment period for stuff in terms of what's approved from the state is closing today. So we do have a state allocation framework that anybody can look at. It's on the Wisconsin Department of Health Services website as a public document, which shows how vaccinating entities will receive vaccine or how it's allocated. It's really important to understand that there's not nearly enough vaccine for the numbers of people that qualify for vaccine. The first groups of people that are going to receive vaccine are healthcare workers and as well long-term care residents. But the numbers of doses in the state are going to be far short of the actual number of people that will need them in the first groups. I tell people it's a little like turning on a dripping faucet with how vaccine's going to roll in. At first, it's going to drip in, but we expect that to increase to a steady stream over the next several weeks to months. So it will get much better over the ensuing weeks and months. And the plan and hope is that as we get into 2021 and the year goes on, that more and more people will not only be candidates to get vaccine, but that they will actually step up and get vaccine, because this is our way out. This same process that I just described with the first vaccine, the Pfizer vaccine, is going to repeat itself next week, because the Moderna vaccine, which is using a similar type of technology called the messenger RNA technology, is going to be discussed at the FDA next week on Thursday with the same follow-up process that I just described. So my hope is that we will have doses of vaccine in the state of Wisconsin sometime next week, although the timelines could be adjusted based on all of these votes and meetings. So I wanted to make sure people are aware of just what to expect, and to not necessarily just follow it in the headlines, but that's the actual outline of how things are going to happen. I also want people to know that with the allocation of the vaccine from the federal level down to the state level, everything has been very transparent and open to the public. These meetings with the FDA are also open and available to the public. At many levels, input was sought from the public, not only for opinions and perceptions, but also to make sure that that the public can trust what's happening here, both on the scientific level and also on the ethical level with regards to how vaccine will be allocated. So I want people to have confidence in the fact that all of these have been open, and public consideration has been considered with regards to all of this vaccine work. So I think I'm going to pause there, because that's a lot of information. And I think Dr. Morcom will talk a little bit about the vaccine candidates and some other information. And then I think we will transition from there into a lot of common questions and try to provide those answers and information.
Hello, everyone. Good afternoon. I am Dr. Erin Morcom, one of the primary care physicians here at La Crosse Mayo. I'm just going to give a little bit of overview. Dr. Knight kind of gave a little head start on a little bit of the vaccines that we are anticipating coming out hopefully very soon. I'm going to give a little bit more information into both of those. So really the front runner that you all have likely heard of is the Pfizer vaccine. There's several different companies that are working on vaccinations, frontrunner Pfizer, and then Moderna is the one that's hopefully coming shortly thereafter. As Dr. Nike had stated, they're both mRNA vaccines. Something really important to know, it does not contain any live virus. You cannot get COVID-19 from taking the vaccination. It basically makes your body or instructs your body to make a protein that is part of COVID-19 so that your body can make immunity against it. So no possibility of at all contracting COVID-19. Even if you do feel a bit under the weather after the vaccination, we're going to talk about some of the common adverse effects that can happen with it. It's not that you have contracted COVID-19 from it. Both of them are going to be 2-dose series vaccines. So once you get 1 dose of it, it's really important that you come back to have your second dose. You don't have the full effectiveness without both doses of the vaccine. I believe they're saying after the first dose about 70% effectiveness, which is still really awesome, but you don't get the 94, 95% effectiveness that is touted with both of these vaccines until you have completed both in the series. The Pfizer vaccine, you get 1 vaccine and then a second, I believe, 21 days after. The Moderna is day 1 and day 28. So about a month between for both of these vaccines. And again, very important that you get both of them. As terms of potential adverse effects from the vaccination, very similar. What I've been telling patients is to the Shingrix vaccine. If anybody's been vaccinated for the shingles over age 50 indication for that, you may get some body aches, you may get some fevers, you may get some chills, just kind of feel a little under the weather. That's actually a good sign that your body is making a good immunity to the vaccine. It's not that you are becoming ill from it. There is a risk of that both after the first dose and actually a slightly higher risk after the second dose. So something for patients and people to know that that is to be expected, and you're not having a horrible adverse reaction that would be a contraindication to getting the second dose of the vaccine. In terms of safety of the vaccine, we all know this vaccine has come about very quickly. We're very thankful that we're, as Dr. Nike had said, hopefully going to be able to get over the pandemic by getting people vaccinated for this, a very important step in that. But every safety measure has been taken. The FDA, all of the public health professionals would not approve a vaccine if we did not think it was safe. So I also echo the same idea as Dr. Nike. Really highly encourage that everyone consider vaccination for this. It will be coming out in a phased approach, as Dr. Nike had stated. So there will be limited quantities to begin with to go to the most high risk people that are going to be potentially in the most occupational exposure, and then high risk patients with comorbidities. But we're hoping as 2021 rolls on, there will be more for everyone so that we can build herd immunity, hopefully, as the year goes on in 2021. Yeah, I think that's all that I have.
Thank you to both of you. So before we open it up to questions from our media partners, I just want to provide a reminder that there is already a lot of misinformation that's being shared and spread about the COVID-19 vaccine. So advising you to be careful about sharing information that may not have been fact-checked, that you see through social media content and other sources. And reminder to check for accurate information. The best websites we can recommend are Centers for Disease Control, Wisconsin Department of Health Services, our health department, or your health department where you live, and of course, your trusted medical provider. So please look to these trusted sources of information to make sure that what you are using to make decisions and what you are sharing with others is accurate. So at this point, we will open it up to our media partners for questions.
I'm not seeing any media questions yet for our media. If you just want to use the raise your hand feature if you have a question. Go ahead, WXOW.
Hi, this is Andrea Albers from WXOW. Jen, this question is for you, and it's not immediately about the vaccine, but we're wondering if there's any indication that we're seeing a spike in cases following the Thanksgiving holiday, or are there indications that perhaps the community followed the directions that were given and a majority of folks decided to stay put and not gather in large numbers?
Yeah, thanks, Andrea. That's a great question. I don't have a definitive answer yet, but I can tell you my team has been looking at that data, and we certainly do see a number of cases that were connected to gatherings. It's unfortunate. It always could be worse, but it certainly could be better. So it's an important thing to understand that we know how difficult it is to have those conversations with your family and your friends about not gathering. We all see it happen, but it is so critical because cases are happening and spread is occurring through gatherings with those outside of households. And with the Christmas and other holiday celebrations coming, it is something we need to be very vigilant of and continue to have courage to have those conversations with our family members.
Go ahead, Tyler from WKBT.
Hear me? Perfect. So yeah, I'm just curious to know, so why won't there be enough vaccine to distribute to all the first vaccination groups right away?
Sure, I'll take that. So first of all, this is a pandemic, so this is a worldwide problem. The companies are predominantly worldwide companies, and there are 7.2 billion people on this planet. There are about 350 million in this country. Everybody is basically susceptible to this virus. And even with the private public cooperative effort to develop vaccine and get it distributed, I want to put this into context. Prior to this, the fastest that a vaccine went from initial preclinical trials to actually being approved was 4 years. So this is being done in 9 months, and it didn't start from scratch. People have been investigating coronavirus pandemic strains since the SARS virus in 2003. And so you can think of this as having some science behind it. Some of the technologies have been studied and have been hopeful for years, but it has taken this investment by both the pharmaceutical companies and the public sector to be able to develop something and get the studies done and get it approved in such a short timeline. The scientific steps were not skipped at all, but the investment in each stage, including pre-manufacturing. But when we're talking about the number of doses available, these vaccines need to be used all over the world. And so just in the state of Wisconsin, if we look at long-term care residents and healthcare workers, the number of people in that group is on the order of 400 to 500,000 people. When we're talking about that many people and that many doses, and remember, these are 2-dose series with the first 2 vaccines, so you have to double that in terms of the number of doses expected. So we need 1 million doses in Wisconsin just for the very first phase of people. Having millions of doses of vaccine available in such a short time frame is an unheard of scientific achievement and public health effort. And as I said at the very beginning, this is the most complex public health endeavor ever in the history of the United States and really in the world, to be able to do this in such a short time frame. Remember, in the Spanish flu pandemic back in 1918 that wiped out a quarter of the world, or a high percentage of the world's population, something like 2 to 5% of the world's population or more. Their vaccines weren't around. They just had the basic public health measures like masking and keeping distance. And so to be able to achieve this in such a tight time frame is a great achievement, but it's not realistic to think that any things could get approved and have 7.2 billion or 350 million doses or whatever we need in the state in such a short time frame. We actually need several vaccines to be approved to be able to accommodate all of the people that will ultimately need vaccine for us to recover from the pandemic, which is why I gave the analogy of a dripping faucet. Even with all of this investment and this really condensed time frame, it's not something that you can go from 0 to 100 in weeks or months. And so people need to be a little bit patient. We are working hard at many levels to make sure that this is done with 3 basic things in mind. done ethically, so it's fair and equitable, amongst other ethical principles, that it's done with good science behind it, so it's evidence-based, and that we're trying to do the best for decreasing the burden of disease and doing it safely and effectively. And then the third bucket, which is really important, is that it's something that we can implement. So these logistics and operations that we need to use to actually be able to get vaccine into people's arms is very complex. So I hope that puts that into context.
We have a question from Emily at the La Crosse Tribune. She asks, if Wisconsin receives vaccine doses next week, will La Crosse County receive any doses next week, or will larger cities be prioritized?
I can answer that too. So the way that the state has decided to do this is that it's not all going to big cities or one centers. So health entities have applied to be vaccinators. When they do that and they're approved and verified, and the reason that process needs to occur is that there's some specific storage requirements for the first vaccine, the Pfizer one, that requires this extra cold storage at -70°C. So this is not typical for vaccines to be stored that cold. So you have to have proper storage and handling. That being said, once they're verified as vaccine providers, there's a scheme, and this is available to the public on the State Disaster Medical Advisory Committee website for Wisconsin DHS. There will be all approved providers will get a partial shipment of vaccines. So we do have several approved vaccinating entities in the western side of the state, including our local areas. And so when vaccine is shipped from the state, we will have vaccine arrive locally as well.
Go ahead, WEAU.
Actually, but seems like my question was already answered already.
No problem. We'll go to WXOW.
Both doctors this morning have said that you encourage everyone to consider getting vaccinated, but we've acknowledged also that there's still a lot to be known about this vaccine. Are there any groups that you would caution about getting vaccinated? Pregnant women, for example?
And Dr. Knight can answer this as well from his perspective, but we do have, we do take care of OB patients in our clinic as well here. In addition, I'm a family doc, but we do OB, and so does our OB colleagues. And I've talked with them about what their plan is as well. As everyone knows, it wasn't really studied in pregnant patients, so we don't really know exactly if there could be risk to them. But since it is an mRNA vaccine, it doesn't have live virus. Theoretically, it should pose a very low risk. So if you're a really high risk OB patient, we may vaccinate them, but if low risk, we're holding off for now. But theoretically, it should not pose risk. There just needs to be a little bit more looking into that.
Yeah, and I'll tell you a little bit about how this is going to work from the process in the three subpopulations that we cannot specifically comment on. So pregnant and lactating women, children under the age of 16 for the Pfizer vaccine, and immunocompromised. In the trials that were submitted to the FDA, 23 women became pregnant during the course of the trial. And in the group that received vaccine, there were no adverse outcomes, so there were no problems, although they weren't able to follow the long-term pregnancies. In the placebo group, there was one miscarriage and one other pregnancy complication. In terms of immunocompromised, there was one patient with HIV, but there was not enough information to comment on those who are immunocompromised and whether or not they have a full response. And then children under the age of 16 were not yet studied either, and those studies still need to be done later in the year. The way that the FDA usually handles this is that they typically will not give licensures outside the range of the information in the studies. That being said, the next group that's going to give us guidance and recommendations is this Advisory Committee on Immunization Practices for the CDC. We do have recommendations from the ACIP and CDC that sometimes fall outside of the licensure guidelines. I don't expect them to go too far outside of the licensure recommendations in this case, especially initially because it'll be an emergency use authorization. But what's going to happen is just what happened in the trials. As this vaccine is used, we will have women who become pregnant during the course of the short follow-up time afterwards. And those women will be studied to see if there's any adverse outcomes. And so we call that the post hoc analysis. And what will happen is as we follow those people in the post-licensure studies, we will gain more information. So I expect that information to come in later in the year. In the meantime, the CDC has said that they're going to give some guidance on how to approach pregnant women. I also expect guidance on how to approach those who are immunocompromised. So that guidance could come as soon as Sunday.
So many people are worried about the side effects this vaccine will have, and as a result will back out of taking it. So what's your advice to those people?
So the most common side effects are usually very mild. So as I had mentioned, fever, nausea, potentially headache, body aches, kind of feeling like you have the influenza type symptoms. It tends to be very short-lived, only 1 or 2 days. And again, in most of I think it was a little bit greater risk after the second dose than the first dose. Um, I just try to tell people that it's actually kind of a good sign that your immune system is making a good response to the vaccine, even though it might not feel very comfortable at the time. It still would be much better to take the vaccine than to get COVID, natural infection, and all the risks that go along with it, plus the risk to other members in the community that could become very severely ill if they were to get COVID-19.
Sure, and I'll just add to that. I think Dr. Morcom said this well previously, that it's actually less side effects when you compare them side to side, which I've done than the Shingrix vaccine. And I'm not downplaying the significance of preventing chronic pain that some people develop with shingles, but that's a very well accepted vaccine, and the side effects are less than that. And then it actually compares very similarly to the tetanus shot or the Tdap shot that we use, and most people don't complain a whole lot about. So the side effect profile is really not much different than any other typical vaccine. And as Dr. Morcom said, having a little bit more of the side effects after the second dose is actually a good sign. Like she said, the immune system is mounting a response and is working. So the short-term side effects are really nothing different than any other vaccine we give, and not much to worry about. I'm going to be proactive and talk about what people are often concerned about is, what about the long-term side effects? This was only studied for 3 months, so I'll address that now and do that proactively. I've been involved with vaccine implementation for a long time, and every time we have a new vaccine, the same questions come up with, is this too new? Let me tell you a little bit about how this process works and why I'm not overly concerned about it. And of course, there's nothing that's going to be perfect until we have enough time, but there's a couple magic numbers that I want everybody to think about. The first one is 6 weeks. With almost any vaccine that is studied, if you're going to have any serious adverse outcomes related to a vaccine, it happens within the first 6 weeks after the vaccine. This is why the studies were designed to go out 2 months. They wanted to capture those. The second magic number I'm going to give you is 1 million. And even when we've had some vaccines that ultimately were associated with some rare conditions, most of the time, once you've administered 1 million doses, you really will have captured most of the rare associations. And so 6 weeks and 1 million doses should make everybody feel a lot more comfortable. Secondly, these studies are all designed to go out for 2 years in follow-up to make sure that the long-term safety is in place. Third, there's going to be safety mechanisms in place that we have for vaccines that we don't have for any other medical intervention. So we have a system called the Vaccine Adverse Event Reporting System, where anybody can report anything, which is a great system. It was put into place in 1990 to help find things that are rare associations, and the system works. And we could give examples of how it has worked in the past. Furthermore, there's people that get vaccine that are followed prospectively, like in actual study groups. That's called the Vaccine Safety Data Link, which is by the CDC to ensure the safety. And then for these vaccines, there's actually going to be enhanced safety. There's going to be a phone app that tracks people prospectively and makes sure that it continues to be safe. So there are so many safety mechanisms in place that we don't have for any other medical intervention. It actually helps safeguard the overall safety of vaccines in general. And this will be true in this case. And there's an additional safety mechanisms in place as well.
And so I'm going to add as well, I think that any type of treatment, medication, vaccine, treatment included, there's always, none of those are perfect. There's always considerations to be made. From the public health perspective, what we do is try to look at and support entire populations. So groups of people, not just individuals. And I think, the receipt of the vaccine has to be safe for you. And I think you're hearing us say today that we believe that it is, but it also will protect your family and will help protect your community. So from that perspective, it really is a community mechanism to prevent the spread of COVID. And I can see our communities struggling with those public health, those basic public health guidelines of not gathering and all of those other things. So I think this is a really important tool, like we started this session with today, to help decrease the spread of COVID in our communities.
And this is probably more than you want, but I'm going to add one more thing that I think will lend some perspective. So with this passive reporting system, it's very important for us in the world of vaccines and public health to be able to track things. But often in the news or in the headlines, things are going to get reported in passive reporting that are going to get confused with cause and effect. And I, once again, want to give you a little perspective. We know that things happen at a baseline rate, okay? And so in the instance when we have a vaccine, there's always going to be things that are associated in time. And so after receipt of vaccine, bad things happen to people, but it doesn't mean that the vaccine caused them. So to give you some numbers to conceptualize this, if we vaccinate 10 million people, in the 2 months following vaccination, we can expect about 4,000 to have a heart attack, about 4,000 to have a stroke. There'll be about 9,500 new diagnoses of cancer, and there will be 60 people with multiple sclerosis, and 14,000 people will die. That's what's going to happen after they get their vaccine, but they're not associated with the vaccine or caused by the vaccine at all. Those are just our baseline incidents of those problems. And what you're going to see is people are going to report things through this passive reporting system, and then it's going to get a headline that says, well, somebody after the vaccine had something that was of significance. And the one you're going to see right now is Bell's palsy. And well, Bell's palsy is a facial nerve paralysis. The baseline incidence of Bell's palsy is between 11 and 40 cases per 100,000 people. And in the study group, there were 4 people that had Bell's palsy that happened to be in the vaccine group. But there was about 22,000 people in that group. When you do the baseline incidence, well, guess what? It turns out to be exactly what we would expect in that population. So it's really important not to get confused by the passive reports of what happens after a vaccine and confuse that with cause and effect. So that's going to be really important for people to consume information in a wise way and not just read a couple of headlines about reports of things that happen after vaccine.
And also, I just think the question on everyone's mind is, when do you expect normal life to return for residents in the Coulee region?
Dr. Morcom can go first.
So it will take some time, and this is very dependent also on how many people get the vaccination to try to get us closer to herd immunity, which ideally we want that to happen with getting a vaccine, not people getting natural infection with COVID. That being said, we also don't know how long the antibodies from natural infection with COVID last, and they may only last 3 months. So really, we're pushing people to get the vaccine. But to get onto your question, we don't really know. We're hoping, least I'm hoping, as we move through 2021, that things will hopefully be able to move closer to normal. I do think it needs to be highly stressed, and Jen and both Dr. Nikes also stressed this earlier, that just because you get your vaccine doesn't mean we have to abandon all of the stuff we're doing now. We still need to be doing our masks and trying to do our social distancing and washing our hands, because you're still at risk of potentially spreading to others or getting it yourself. You're not going to have immunity right away after you have the vaccination. So continuing to do our public health measures, and hopefully if we get a good uptake of the vaccination and we're continuing with all that as 2021 moves on, we're in a better position.
Yeah, and I'll comment as well. I totally agree with Dr. Morcom. Most of it is going to be dependent on vaccine uptake. And then we also need these other studies to come through on children and these other subpopulations, so we can get as many people immunized as possible. Once again, I want to point out, and this has been something that's been procreated on the internet and other sources, but we have never achieved herd protection or herd immunity through natural infection. That's never been done in the history of the world. Herd immunity or herd protection is actually a phenomenon that we see only with vaccines. And so we do need to get to pretty high levels of vaccine delivery before we can approach herd immunity levels. So there are various estimates out there, but it really is going to be dependent on us doing the right things and some of these other studies coming through, so that we can ensure that the virus doesn't have hosts. And this is the virus is not a living thing. Its only job in life is to find a host. And until we collectively act together to try to give it fewer hosts, we're going to continue to have to deal with this virus. And this is why it goes back to the things we're talking about. The only way to not be a good host is to mask and wash your hands and keep out of closed indoor spaces, because that's the way it finds hosts. And then we have these new tools coming along, the vaccines, which will make us immune so it can't invade our bodies. It's its only job. It doesn't care about anything else. It doesn't care about what we think or what we believe. It cares only about finding hosts. And if we collectively act together to decrease the opportunity for it to have hosts, that's when it will go away. I'm hopeful that towards the end of 2021 will look more normal, but it is dependent on all these factors, and we definitely have a lot of work to do, and there's a few unknowns out there yet that we'll have to work our way through.
Will either Mayo or Gunderson serve as a hub for regional distribution of the Pfizer vaccine?
I'll take this question. This is an interesting one to me, and since I'm involved on a few different levels with all of this stuff, I saw some press releases about some places having news that they're a hub. Let me tell you a little bit about the hub and spoke model and what it means. And the hub and spoke model just means that there's centralized delivery, and then they're sent regionally to make sure that vaccines delivered not just to these bigger urban centers, but all over. It's actually not something that I would think anybody would give any PR release to. So it was very interesting to me. In the case of the Pfizer vaccine, it requires this ultra cold chain storage, which means that there are special freezers that are required. We are very fortunate to have two fully integrated systems of health in town that have a lot of potential to take care of people both in our more urban centers and our more rural centers. So we're fortunate that we have the capabilities to have centralized vaccine and then get it out to our regional affiliates and partners. And so this designation of hub and spoke is actually a faulty one at its base. That's just the model that we use when we talk about vaccine delivery, and is not like PR or special designation that I've ever been aware of, though I've been aware of this model of vaccine delivery for quite some time.
Thank you. That really helps. Just to clarify, so both facilities are equipped with the type of freezer that would be needed to store the Pfizer vaccine that's already been in place for, similar vaccinations if needed.
I won't speak for Dr. Morcom, but I believe that is true, correct? Yes.
Yes.
Yes. We're fortunate in, as I said, that we have facilities throughout Western Wisconsin that are going to be able to accommodate both the Pfizer vaccine, which is going to be a relatively fewer dose, allocation than ultimately the Moderna when you look at over the course of 2021, assuming that the Moderna and Pfizer vaccines get authorization. So the overall allocation plans would probably be that Moderna will end up being the bigger supplier in the US over the course of 2021.
Moderna doesn't have as cold of it can just go in a regular freezer, not the deep cold freezer like Pfizer. So that's also really nice for more rural places or places that might not have access to the storage for that. So that will be good if that one ends up materializing as an emergency use too.
Hey, it's Rick at Wisdom. I'm sorry if someone asked this because I stepped out for a minute, but would we ever be in a case where we have to get the vaccine every year? Like, I know when people get COVID, sometimes 3-7 months later, they can get COVID again. So I'm thinking, like, if you get the vaccine, maybe 3-7 months later, you can get COVID again. So I don't know. I don't know anything about vaccines, so maybe that's a stupid question.
No, that's actually a really good question. And it's one that we don't really have all of the answer to yet, simply because this vaccine is obviously a new vaccine and we haven't had enough time to continue to watch people over time to see how long their antibody response will last. So we don't know if it's going to be a one-time thing, if you have to have it annually like a flu vaccine, if you have to have it every 10 years like a tetanus vaccine. That's all to be determined. So potentially in the future, you may have to be boosted with it. More to come in upcoming months and years.
Yeah, and I'll just add, whenever we have a new vaccine, this is a common question. Do we need more doses? When do we need doses? Here's why you don't need to worry about that. There are tens of thousands of people that are being followed for this that were volunteers for clinical trials. And so we'll know all about this before the average person who wasn't in a clinical trial will ever need to know. So that information is forthcoming. These study participants are going to be studied for 2 years post-licensure, and then we'll have even more studies beyond that to look for people's need for future booster doses. And so I get asked that every time we have a new vaccine, and it's never really a big concern because of the way the studies are designed and the fact that before the average person ever gets vaccine, we will be able to, not before they get vaccine, but we'll be able to answer those questions going forward from the participants and the brave volunteers for the clinical trials.
And I don't see any other media questions, Jen.
Okay, thank you. Well, I do just want to say thank you to Dr. Morcom and Dr. Nike for being on today, for all of you who are watching. Again, we are really hopeful about this vaccine. We need your help to be knowledgeable about it and to be willing to help with the herd immunity against COVID-19 so we can decrease the spread in time when you are eligible to receive the vaccine. So please continue to look for good information. Be careful with some of the misinformation that's out there. Go to the websites that we can trust that I previously mentioned. And until we are able to get enough people vaccinated in our communities, which is likely to be months, please remember to follow all of the guidelines that we continue to encourage. All of those are to decrease the spread of COVID-19 and its effects in our community. So thank you again so much for being with us today, and I hope you have a wonderful weekend.
Thank you, everyone. I think Andrea, if you're still on, I know you had a question last minute. Do you want to ask it before everyone hops off? Go ahead.
Oh, sure. Thanks. Sorry if this was mentioned earlier in the conversation. Just wanted to confirm whether or not it would be accurate to say that both health systems expect they'll get deliveries of the vaccine sometime next week.
I'll answer that. There's no guarantees of next week until these other things occur. So we need emergency use authorization. The ACIP has to render their recommendations, and then government has to ship to state, and then state has to ship locally. So, you know, I know everybody wants a firm commitment on the timeline, but and the exact date it's going to arrive, but we can't say that for sure until these things come through. And what I will say is that I know both health systems are preparing to be able to give vaccine, and that's the most important part. We can't control whether or not it arrives, but we can control whether or not we're prepared to deliver vaccine. And that's what I know both organizations are working very hard on, so that we will be prepared when the time comes.
Yep. Echoing that, we're basically making sure we have all of our stuff in line, which we basically do at this point. So waiting until they send it to us.
Thank you both for your time and to our media today.
Thank you.
Have a good day, everyone. Thanks,
Thank-
Colleen.